Hare Krishna. Am I audible?
Yes, Mataji.
I welcome all of you on a new topic, that is premenstrual syndrome. Most of the females, they suffer from premenstrual syndrome, and sometimes they don't know actually it is called as a premenstrual syndrome. So what is premenstrual syndrome? What are the symptoms and how we can relieve this premenstrual syndrome? We will see in today's session. So basically, PMS, it is in short, it is called as PMS. So that is premenstrual syndrome. The premenstrual syndrome is a combination of symptoms that many women get about a week or 2 weeks before their period, right? So what is the date of the period? Before that, a week before, they get these symptoms. Most of the women, like almost 90% female, they get these premenstrual symptoms. For example, bloating, headaches, moodiness, and in some cases it is the symptoms are too severe that they cannot do their daily activities also. They have to just keep on lying down. Either if they are doing office work, they can't go in the office. If it is a school girl, she can't go to the school or she can't go to the college. So that much severe it is, and once period starts, the symptoms comes down. On an average, women in their 30s are most likely to have PMS. That is the data we have seen. So if we want to understand premenstrual syndrome, or what are the symptoms and why you get those symptoms, we have to understand menstrual cycle first. So how the menstrual cycle works, and then we will be able to understand why these symptoms are happening in me. Okay. So basically, if you see in the picture, there are 4 phases of the menstrual cycle. So what we see is the outcome, that is the menstrual phase only. So only menstrual phase is like that is a bleeding phase is visible. So we can understand that, yeah, from my menstrual cycle, this menstrual phase is going on, right? But other 3 phases are also there, and that lead to different changes in the hormones. And our body and mind also gets affected by all these hormonal changes. So we have to understand which are the hormones which are working for it, and why we get mood change, or why we get certain symptoms, because there are certain things which are acting during that period. Then only we will understand the this PMS. So basically, in this slide, I would like to explain the names. So this is a follicular phase. After that, only menstrual phase comes. After menstrual phase, there is a luteal phase, and then ovulation phase. So we will see like 4 or 5 days before menstruation. These are the actual symptoms which you get in a PMS. So most of the female, they get abdominal pain. Then they get constipation, either constipation or diarrhea. They feel something different in the abdomen. Then some of the females, they might feel dizziness also. Some females, they get cramps. Some females, they get severe headache, or if someone is suffering from migraine, they get their migraine attacks during this period. Then low sex hormones, sweaty and fatigue. So these are the common symptoms which most of the female experience. It might not be all the symptoms, but few of them will always be there. So basically, as per Ayurveda, because we calculate everything from Vata, Pitta, Kapha. So if a female is a Vata dominant female, so you can see in all my classes, I explain that you should know your body type. When you know your body type, then only you will be able to understand which dosha dominant you have, and then only you will be able to treat yourself or do some home remedies in such conditions. So in upcoming sessions, there will be a session for Prakriti analysis. You all must attend that, so you will be able to understand which dosha dominance you have in your body. So a female, if she is a Vata imbalance, or if she is having a lot of Vata in her body, or a Vata dominant female, then following are the symptoms which she will get during the PMS. First is mostly nervous tension. She will be like more stressful, anxiety, mood disorders, Some female even get suicidal thoughts without any reason. There is no reason. They understand that everything is happily going, everything in my family is happy, situations are quite better, but still she will get suicidal thoughts. Some female might get insomnia. Forgetfulness is again common symptom. Confusion is also found a lot of time. Constipation is there. Cramps are there. Backache or headache also will be there. A few of them will be there. Then if a female is a Pitta imbalance or a female is a Pitta dominant female, then in her, the predominant symptom will be anger. So you can see without any reason, this female will become angry, irritable with the small things. Even someone says in a family, someone says little thing, she will be like, you can see in the picture, she'll be like bursting out with the anger. Then appetite in female, Pitta dominant female, the appetite will increase. Headache will be there. In this case also, if she's already suffering from migraine, then her migraine issue will increase during this period. Feeling of excess heat in the body. Sweating also will be there. Diarrhea will be there. And in some of the female, even skin rashes also will be there. So you have to just observe what are the symptoms which you are getting. Then some female, if they are Kapha dominant female, they will have weight gain. They will feel during this period they are putting on weight. Then breast tenderness will be there, bloating will be there, and they will feel lethargic. They just don't want to do their work. They just push themselves during those days. Then loss of appetite will be there. They don't feel like eating anything. They just want to sleep. You can see in the picture, they just want to lie down or sleep throughout the day. Then oversleeping, and if some female is already suffering from psychological issues, she might get more depressed during this phase. So you have to be a little bit careful. If a female already on some psychiatric treatment, she might get more depression during this period. So and once the menstrual cycle starts, which is like 1 to 4 days bleeding, in Pitta dominant female it could be 1 to 7 days of the bleeding, but in general Vata and Kapha dominant female, they will have 1 to 4 days of bleeding. So automatically all the symptoms which we have seen during the PMS will start reducing. Blood flow will start. Fatigue will be there, but slowly once 4 days are over, fatigue will come down, and then backache will be there. So during the menstrual phase, the PMS symptoms will come down automatically, right? So they get a sensation of relieved. Once the bleeding starts, they get a sensation of a relieved. And after that, after the period phase is over, like menstrual bleeding is over, then next 5 to 8 days, their hormonal level will rise and they will come slowly back on the track. And they will feel more social. They want to go out. Their skin becomes good looking. They want to be social. So that is like how the hormones make them behave like that. Then next 8 to 9 days. So what happens? Because generally I have seen like Pitta dominant female, they bleed almost for 7-8 days. So after 8-9 days, the flow almost comes to 0, right? So in them, the estrogen level rises slowly. And once the estrogen level rises, they feel a sense of a calmness. So whatever feeling which was there in the PMS, like a disturbance, a lot of chaos will be there inside, they will automatically start feeling calm. Then their energy and stamina also will increase. So they just want to do all the work, their energy levels come up. Then skin and hair become smooth and good. And then their pain also reduces. In day 10, the fertile window begins. So there are chances of getting pregnant. So in the next 7 days, the chances are increasing for getting pregnancy. Day 13. So on the day 13, the estrogen levels increases. High sex drive will be there. You may become more sensual. Discharge, little clear white discharge will be there, which is stretchy, like egg white. Why this discharge is there? It helps sperm to move inside the uterus. So this is how nature is making arrangement for the lady to get pregnant. So those who want to conceive, for them, generally those who come for the Garbhadan Sanskar here for the treatment and all, we recommend them to have a conception during these days. So there are chances where there are almost 99% chances are there you might get pregnant during this time period. So 13-14 days are the more sensitive period for getting pregnant. So 14th day, most of the time the follicle ruptures, and they in the uterus, in the ovary, the egg is released. So some of the female, they might feel little cramp in the abdomen. They feel a cramp in the left side. Sometimes they feel cramp on the right side, because alternate time the ovaries will release the egg. And then day 15, the ovulation occurs, and highest most chance of getting pregnancy. So what happens if pregnancy doesn't happen? Then day 16, the shift in estrogen level starts. So because estrogen is coming up, that is, the nature is making arrangement you to become the pregnant. But if pregnancy doesn't happen, if conception doesn't happen in this time period, then slowly estrogen level will slowly drop down. And then from 17 to 22 days, the fertile window ends, and chances of getting pregnancy start to reduce. So in this time period, the progesterone hormone increases, and slowly again the female starts feeling tender breast. So low estrogen level, actually it affects the serotonin level also in the brain. So this serotonin level causes when serotonin reduces, even depression starts or mood swing starts. And then discharge becomes thick and creamy to protect uterus from the infection. And again, the next part of this cycle is again 23 to 28 days. So that is actually premenstrual symptom. So in this time period, now we have understood that low hormone levels, because estrogen is responsible for making us happy and calm and functioning well. But because estrogen drops down and progesterone increases, then the premenstrual symptoms starts getting. So lack of discharge will be there, feeling of dryness will be there, prostaglandin production will be there. Because of that, some of the female might feel back pain, pain in the legs, headache, all those symptoms will come. And again, the periods will start. After 28 days, again the cycle will repeat. But now you have understood how it works. It is a cycle of the hormones which keeps on changing all throughout the month. So not all the 30 days are similar for the female. It is the difference of the hormones which is there in their body, making them act like that. But now, when you understand the cycle, then you know what to expect. Now you have understood that now my 23 to 28 period is coming. So I'm going to become little irritable. I'm going to become little nervous. I might cry without any reason. I might get some abdominal pain or cramps or disturbance in the abdomen. I might not get appetite. I might not get sleep. All those symptoms, you know. When you are blind, you don't know that what is happening, then everything becomes chaos, right? But when you understand that, yeah, these are the symptoms which I'm expecting, and then when you understand and you notice it that, yeah, this is my PMS has started, then only you can treat it. Okay. So in general, we can see on a physiological level, some of the female, they will get acne. You might have noticed before period, you get 1 or 2 acne on the face, because the progesterone hormone has a sensitivity toward the sebaceous gland. Then you might get back pain. Some of the female, they feel water retention. They feel swelling of the hands, legs. The ring, if they are putting, it becomes tight. Painful tender breast, muscle cramp, diarrhea or constipation, and migraine. If there, it aggravates. So these are the physiological symptoms. And overall, psychological symptoms will be irritability, anxiety, anger. That is because of low estrogen level. Loss of sleep or excess of sleep as per your dosha. Then crying spells. Without reason, you cry. There is no reason. If someone says something little bit and they cry like anything. So, and even family members also they don't know what is happening, why she is crying unnecessarily. Then you are unable to focus. If you are working, then in a work also you are not able to focus. Craving is some female, they might get more craving because insulin sensitivity also is reduced. Then depression, sadness, mood changes, all those things will be there. Insecure female, insecure feeling. Specifically those who are like married female, they might feel more insecure if their husbands are not working, or if their husbands are not that much conscious about talks, and give emotionally also not much conscious. And sometimes they speak something and then you start feeling insecure. Then doubting mentality also might come during those days, and then negativity also might come. So these are overall psychological symptoms a female face. Okay. So now you have understood that this is the cycle: follicular phase, ovulation phase, luteal phase, and menstrual phase. These symptoms are going to come down when your menstrual phase starts. Okay. But if someone is suffering from severity of the symptoms are mild, that can be get relieved by like just self counseling or reading something or focusing on something, distracting your mind from one thing to other thing. All those things can be done. But if symptoms are severe, then you need some support through medicine, support from other family members. Okay, so now you have understood this is how the hormones are working on your body, right? So in the PMS, the progesterone is high, estrogen is low, serotonin is low. Okay, so what Ayurveda says, this was like a allopathy point of view. I have explained all the menstrual cycle and what happens, what are the hormones, they work like that. But Ayurveda says that all these symptoms the causes are because of the imbalance in the doshas. More specifically, if you want to say, it is because of the apana vata. It is a specific kind of a vata dosha which works in a lower abdominal region, okay, which is responsible for the elimination of a menstrual blood, stool, urine, and reproductive fluid. So when apana vata is disturbed or imbalanced, then only you get more severe premenstrual symptoms. So on the onset of menstruation, this apana vata increases, and because of that because all the doshas are connected with each other, not a single dosha is functioning independently, right? So when one dosha imbalances, specifically if it is a vata dosha, it imbalances other doshas also. So when vata is imbalanced, it will imbalance other dosha, that is a pranavayu, another type of a vata dosha, and because of that, and that is located in the head. That's why you get anxiety, mood disorders, and migraine type of symptoms. So basically, it's the overall vata dosha which is causing all these problems. So from Ayurveda perspective, we try to correct or we try to balance this dosha. So how to balance? So basically, you have to do lifestyle changes, because Ayurveda is the science of prevention. Basically, it focuses more on the prevention. So that's why first thing which you can do is lifestyle changes. As I have explained, is because of the vata dosha elevation, you get all these symptoms more. If your lifestyle is more, which increases more vata dosha, if you are not eating on time, if you are not sleeping on time, if you are acting, or if you are hyperactive, or if you are overburdened physically, or if you are overburdened mentally, then vata will get in imbalance. Then your symptoms which you get during the premenstruation phase will increase more or can be worsened. Okay, so you have to balance this by doing some lifestyle changes. That's why meditation plays a major role. Meditation helps you to balance your dosha, to balance your hormones. Maintaining a regular lifestyle is very important. Nowadays, what happens? People work as per their people have their lifestyle as per their working hours. So when they get lunch break, sometimes they get 3 o'clock lunch break, then they eat their lunch at that time. Sometimes they have to leave house at 7 o'clock. They will have their breakfast by 6:30 a.m. in the morning when there is no digestive fire in the stomach. So all those things. Then sometimes they come late in the night after the office, and then they will have their food, and then they will sleep late, because they know immediate after taking the dinner, you are not supposed to sleep. So if they take their dinner at 9 o'clock or 9:30, they will sleep by 11 o'clock, which itself is a cause for increasing vata dosha. So maintaining a regular lifestyle, some changes here and there, so that you can maintain a proper timings of the food, and maintaining it on a regular basis will definitely help. Then plenty of exercises, because during PMS, if you want to stay mentally strong, you need to do some exercises, because exercises make you strong physically also and mentally also. Taking time to take rest and relax also. So basically, whenever you get time, take proper rest, relax yourself, do certain things whenever your weekly off is there. Do certain things which gives you pleasure. Don't carry away only because the female, most of the female, they have this tendency. They will, when they get off, they will behind their family members. They will try to satisfy them, and they will neglect themselves. That is the typical mentality of the Indian female. But see, basically, if you want to serve them or for a longer time or longer period, then you need to be healthy. So take time for the rest and relax, and avoid overstimulation. That most of the time is happening through mobile, internet, all those kind of things. So try to balance your dosha. If someone is a vata dominant female, if she is suffering from nervous tension during PMS, if she is getting a lot of anxiety, mood disorders, suicidal thoughts, all these are symptoms of a vata imbalance. Insomnia, forgetfulness, confusion, constipation, cramps, backache, headache. Then understand that you are a vata dominant female. So vata has gone up. Then specifically during this period, you should have a food which will be balancing your vata dosha. So what are those food items? You have to include sweet food items in your diet. Sweet doesn't mean sugar is sweet. Sweet means the nourishing food. So you can include jaggery. You can have warm rice. You can have khichdi. Then you can add citrus things also, so that because vata gets pacified with these three tastes: sweet taste, sour taste, and salty taste. Hmm. So those who are vata dominant female, or those who are getting above the symptoms which I have explained, they should include specifically this taste. You can have warm dishes with a smooth textures, soupy kind of a thing. So no dry food is allowed during this time. No cold things. You don't take cold things. Take all these kind of foods and avoid raw and cold food. Okay, because raw food will increase more vata imbalance. And useful herbs for such a condition is Brahmi, Ashwagandha, Jatamansi, and Gudushi. So these are the herbs which will help you to cope up with those emotional symptoms, and along with that, even physical also. I will recommend for the physical symptoms, you can have massages to be done, self oil massage. There is no need to go in any massage center. You can just do self oil application every day, specifically on the area of the abdomen and back and legs. So lower abdomen portion you can cover, and you can do oil massages, warm oil massages, self oil application. After that, you can take warm water bath. And if someone is having severe symptoms, like a lot of suicidal thoughts are coming, then you need to get connected with a doctor, Ayurveda doctor, and then you can do certain soothing therapies, like for example, full body massage or feet massage or shirodhara, this kind of a thing. Feet massage can be done at home also. So these are the certain therapies which we generally recommend. Then certain yogasanas also will help, like for example, Ustrasana, Gomukhasana, Bhujangasana, because they work on a lower abdomen. So they will facilitate your apana vayu to do the functioning properly. Then pranayam will help, emotional symptoms. If someone is pitta dominant female, if you feel that, if you have to observe yourself. If you feel that during your premenstrual phase, you are getting angry without any reason, a lot of anger is there, you are shouting at everyone with little simple mistakes, you are just finding out the mistakes and bursting with the anger, then that means you are a pitta dominant female, or your pitta has imbalance. So that time what you can do is opt for the food that are sweet, bitter, and astringent, and cooling in nature. So basically, symptoms like irritability or anger or increased appetite, headache, migraine will increase, a feeling of internal heat will be there, rashes will be there. So if you are suffering from all these kind of symptoms, then you can see in the picture I have shown, you can include basil, you can include dates, you can even include dandelion greens, turmeric, you can include parsley, you can include pomegranate, you can also include amla, you can also include jamun. All those things help in balancing pitta. And then avoid spicy, salty, and sour food, because they will again increase more pitta, and then you will become more angry, your pitta will get more imbalanced. So therapy is like again in Pitta Imbalance also you can do self oil massage, but the oil you can use Pitta dominant female can use coconut oil because it is a cold in nature. It makes body cold. And then Shirodhara also can be used if someone is suffering from sleeplessness or lot of anger issues are there. Then go for Shirodhara. And then the herbs are like Shatavari and Kumari, that means aloe vera. So Shatavari is one of the best herb which I have even seen in the practice also. It helps female a lot. So Shatavari is also called as like a friend of the female. Basically, it's a female tonic, you can say. It helps to balance all your doshas. It works on the mind also, and it helps you to calm down. So those who have started Shatavari and taking Shatavari for a longer period, then they feel the difference. PMS, how their previous PMS was there, and now how the difference is there. Aloe vera also helps because it is a uterine contractor and it is cooling agent. So that's why internal aloe vera internal taking also will help. So it will reduce your heat in the body, and it will help to facilitate your menstrual phase fast because it's a uterine contractor. Then Yogasanas, Naukasana and Dhanurasana. These are the yoga postures which will help during the Pitta dominant, during the PMS of the Pitta dominant female. And Shitali pranayam, as you all are seeing a lot of yogasanas and all those things, learning all those things. Shitali pranayam is one of the pranayam which makes body cold, right? So this also can be done, which will help you to keep your anger also down, and internal heat also will come down. Again, those female who are kapha dominant or those female who have a kapha imbalance in their body, they will feel the symptoms like weight gain, breast tenderness, bloating, lethargy, loss of appetite, oversleeping, and depression. If you are feeling all these symptoms, then what you can consume? For such a female, you can see in the picture all the things which I'm saying not to take are allowed to take these food items. So you have to take spicy things, little bitter things, dry, warm, light things. You can have more spices because kapha kapha qualities are exactly opposite of these spices. So you have to what you can do, kapha will, because kapha is more of lethargy, weight gain, and all those things. So this medicine will, these herbs or this kind of food will help to improve the metabolism. Spicy things, bitter things, astringent things, all those things will help to improve the metabolism. And you have to stay away from the food items which are more oily, more sweet. Avoid sweet, avoid sour things, and avoid more salty things. Okay. And if you are a homemaker, if you are staying at home, avoid sleeping during daytime. That is very much important because that will increase your kapha tremendously, and your symptoms also will increase more. And if someone is suffering from psychological issues like, for example, depression and all things, they will tend to sleep more during this time period. So make yourself more active, do some exercises, try to be more active during this phase specifically. Then automatically the symptoms will come down. And you will fresh, mentally also you will feel fresh. Again, kapha dominant female, the herbs which help are Shatavari, Ashwagandha, and Trikatu. Trikatu means it is a combination of three herbs: Shunti, that means ginger, dry ginger, Maricha, that means black pepper, and Pippali. Pippali is again one of the herb which is hot and pungent in nature. So it comes in a combination. Like if you go in any medical shop, you will get Trikatu powder. So it comes in the combination; it is easily available. So that also can be taken. So it can be used in the form of either tea form. You just boil it along with jaggery, or maybe little salt, or little you can mix it with little honey once it becomes lukewarm. But this kind of teas you can take if you are a overweight and kapha dominant person, and you are getting all these symptoms which a kapha dominant female gets. And in this kapha dominant female, we recommend to do powder massages. Just oil application, and after that homemade powder massage either with triphala or horse gram powder. You can use any of these powders and do powder massage. That will again improve your metabolism and help you to stay active during this phase. Yogasanas and exercises for kapha dominant female is aerobic exercises, Surya Namaskar, spinal twist can be helpful. Basrika and Kapalbhati also will be helpful. So general guidelines for diet and lifestyle is sometimes what happens, you don't know what is your dosha, and you get mixed few symptoms from Vata imbalance person, few will be from Kapha and few will be from Pitta. Then you get confused that I'm getting all the few symptoms from all the doshas, what I should do. So for such a female, this is general guidelines. Take more oats. You can add ginger and cinnamon. You can have a ginger and cinnamon tea without milk, which works as a very good anti-inflammatory tea. You can include the food items which have more potassium and magnesium, for example, almonds or banana. If you are kapha dominant, don't take banana, but if you are vata pitta combination, then take banana. Sleep at least from 10 to 6. This is the minimum sleep. Okay, so that will make you because the again during first part, like part of your sleep, that is 10 to 12 sleep, you will get those happy hormones which will make you feel fresh. Include B6 food items, for example, beans and grains. Reduce salt and sugar, but those who are a vata, for them we recommend to have a little salt, rock salt. Dark chocolate also can help in a psychological factor because they have improved to be a stress reliever. But again, I will recommend not to be recommended for a kapha dominant female. If you are already feeling sleepy and lethargic and all those kind of things, then don't take it. Uh, Drink warm water. A lot of warm water will help. Then green leafy vegetables and fruits can be included because they will also make you more fresh. Avoid bakery products. Avoid smoking, alcohol, and day sleep. And talk with a friend, husband, family members. Open up your heart, which will help you in a psychological disturbance. Actually, here I just want to explain because I wanted more that if husbands had attended this session, I would be happy because here role of husband also can make a lot of difference, or he can make PMS as a gift to the female. So what husband has to do? There are 4 steps. Step 1 is set a calendar. Be ready for it. So when you set the calendar that this is the time period for my wife's PMS, then you will be mentally prepared. You will be prepared that she will be irritable. She will have all those disturbances. She will be in chaos. So you will not respond. So that will come in next point. Step 2 is when female is emotionally disturbed, she needs more love and care. If you just give some love, you can help her by doing some feet massages. You can help her by giving some chocolates or giving some flowers, which will make her psychologically more happy. Then third step, which I think every husband should follow, is just listen and don't be rational or logical. Join her in her issues. Make sure that you are explaining that, yeah, I can understand you are going through PMS, your hormonal changes are happening, your progesterone levels are high. That's why you are behaving like that. Or you can make her feel that I'm able to understand you. And then whenever she is angry, you just keep calm. Don't react. What happens when without reason, if she's shouting, then you feel why she's responding like that, and you don't understand that she's behaving because of this PMS phase is going on. Otherwise, she's a very normal and good lady, but because of these hormonal changes, she is having all these issues. So just try to understand her. And step 4 is don't take anything she speaks. Don't take it personally. It's you have to just remember this one sentence, or you have to just understand or underline this one sentence. What is that? It's not she is speaking, but the hormone. Otherwise, when her this phase is over, automatically she is going to calm down. She's going to come on her routine things. She will be again good mom, good wife, everything, good daughter-in-law. But during this period, because this period is very sensitive, when she speaks something, you speak again something, and then whole chaos happens. So this is again very important point. If you just remember this one sentence, then most of the things will come down. So I want to support this because there is a research done on this point, and they have made the husbands aware of this thing. Okay, when the men were aware, and when they started practicing, and they were given some training for this, that how you should behave during this period, Then it is found that most of the divorce which has happened during this period has come down. Okay, um, a husband can make this PMS a happy PMS and avoid all these complications which generally happen during the couple. Most of the crucial time period is this time period. So PMS is actually really a struggle because nowadays the lifestyle has changed a lot. Um, Females are not able to follow the regimen properly. They are not able to give time for their health. When they are working, then it becomes more double, and then it becomes really a struggle. So PMS is really uh, uh, struggle. So take home message for all the husbands is respect their PMS. When you understand, when you set the calendar, when you are ready for that, or it's not only for husband, because I'm saying why for the husbands, because husband is the person who is more connected to the wife. But if all the family members, like other members who are there, are made aware of this time period, crucial time period, then definitely the phase will get over, and it's going to come every month, right? It's not just one time. It's going to come every month. So if you just keep calm during those time period, definitely the divorce or the whatever difference of opinion or whatever things happen will come down in time. So thank you for all of you. This is what I wanted to explain about PMS. If you have any questions, we have enough time for the question answer. So you can ask your questions in the chat box. I'll be able to answer all of them. Oh, there is already one question. So can we take Shatavari on a daily basis? What is the recommended dose? What is the recommended dose? Okay, so yes, Shatavari can be taken on a daily basis, and the recommended dose is 1 to 2 teaspoon along with milk. If you are taking milk, you can take it with mix it with a milk. Shatavari kalpa, Shatavari powder is ready made available. You can mix it with milk and have it. If you are not able to tolerate, or if there is a lactose intolerance, then you can have it with warm water also. Can we fast during our periods? That is again one question. See, basically, here again I'll answer as per your dosha. You have to make sure if you are a vata dominant female, and if you fast during the periods, then vata will again increase more. So in such cases, I will not recommend. But if someone is a kapha dominant female, heavy body, overweight, then they can fast. But make sure you drink lot of warm water during your fast and eat something. Don't remain hungry. Eat something like fruits and all. But you can take some warm water, or you can take some teas like ginger tea, ginger jaggery tea, or cinnamon jaggery tea, which will make you calm down. So only kapha dominant females are allowed to fast, but pitta and vata dominant females are there. They should not fast. Why is the menses more than usual, or it continue for very long time, like 20 or 25 days? Okay. So see, basically when periods are, because we have seen the time period is only for the shorter duration. Maximum it should be 7 to 8 days. That is which is seen in a pitta dominant female, right? So if it is for 20 to 25 days, then definitely there is a bigger hormonal imbalance is there. So you have to make sure why, what is the reason. Do ultrasound. With the ultrasound, you will be able to understand if there is any PCOD, or if there is any lump in the uterus, or something abnormal in the uterus, which is making you bleed more. So make sure you see a gynecologist, do your ultrasound, and then as per that you take decision. With the support, you can go to the any Ayurveda practitioner also. You can show your ultrasound report, and along with that they can recommend you certain good medicines are also there which will help you to reduce the bleeding. But this is not abnormal, this is not a normal, actually it is abnormal thing, and it should not be neglected, because a lot of blood loss will make you more anemic, and it will affect other organs also. Then there is a question, any side effects of Shatavari? As per my knowledge, there are not Shatavari, because it comes under Rasayana category. There are say almost 8 herbs which are mentioned by Acharya Charaka, which comes under Rasayana category. So Rasayana medicines always help our body to nourish, always help our body to support. It will create balance. So that's why it will not give you any side effects. But only thing is that make sure you are taking Shatavari from a good company, well-known company, because nowadays lot of mixing is found. So if you are instead of Shatavari, if you are taking another powder, then definitely side effects will be there. So certain well-known companies are Kottakkal, Arya Vaidyashala, Dudh Papeshwar. These are well-known companies whom you can trust. Himalaya is also one of the good well-known company. So you can trust and you can take Shatavari from those companies. There is a question, what about traveling? Can we travel or take flights? This is a question regarding periods. I hope this is like that because during PMS, you can travel. There is no restriction regarding that. Only the thing is that you have to, because when you are traveling or if you are taking flight, again, the changes will be there on a physical level and on mental level also. So make sure you continue with certain herbs like Brahmi, Ashwagandha, Shatavari. Again, you can take on a regular basis. So you will not get affected with the changes which are happening because of the travel. There is a question that is Shatavari helpful for all the doshas? Yes, generally, if you see, because Shatavari is all nourishing, Shatavari is helpful in all the doshas, even because it has a little astringent and bitter taste also. So that's why it will help in a Kapha dominant female also. But make sure Kapha dominant female, they don't take it with the milk, you take it with warm water. But other doshas, they can mix it with the milk. So yes, for all the doshas, Shatavari can be taken. There is a question, is taking Triphala better or Shatavari better? Are there any suggestions based on age? Best way to take Triphala? See, Triphala, sorry, Triphala doesn't have any major role on balancing the hormones basically. Triphala also comes under the category of Rasayana, which I was explaining. Shatavari is also one of the Rasayana. So all are nourishing on the body, but basically Shatavari helps to balance the doshas. It nourishes your uterus. It also helps to balance your vata, pitta, dosha. So that's why Shatavari is more recommended if you are suffering from the premenstrual syndrome. But if you are suffering from constipation, if you are getting hair loss, all those kind of things, then you can go for Triphala. Even if you are suffering from weight gain, then also Triphala helps. So there is a basic difference in Triphala and Shatavari. So Shatavari is more on recommended more on a hormonal imbalance conditions, and Triphala is more on a physical things. Best way to take Triphala is, I'll recommend if you can take powder. So because there is a time limit which is mentioned, if you take, because if you take Triphala tablet form, you don't understand or you don't feel the taste of the Triphala. But it is recommended that Triphala should be continued. It has all the 5 doshas except salt. It has all the 5 doshas, 5 taste. Sorry, all the 5 tastes. So Triphala, if someone is having some imbalance, they will feel astringent taste of the Triphala. Someone will feel it. Someone will get the taste of Triphala. Will be more prominent taste. Will be bitter taste. Someone will get a little uh, astringent and bitter together. But when you start getting sweet taste, when you take Triphala, that is the time. That means your all the doshas are balanced, and you can end. You can stop taking Triphala. So that is the sign. Till how long Triphala to be taken. So better if you can take in a powder form. If you are able to take it in a powder form, that is the better option. Take it 1 spoon along with a little warm water. What should we take after period for getting back? This is a good question. See, basically what happens during the period, lot of blood loss is there. And those female who are suffering from anemia, they will feel more weak. And almost 70-80% females in the India are anemic, right? So there are certain medications like iodine syrup or iron supplements generally we recommend, or even shatavari also you can continue taking. And you can take certain rasayana kalpas, more stronger rasayana kalpas. For example, narasimha rasayan, or you can take chavanprash. So these are all the herbs which help to rejuvenate faster. And then certain food items also, like if you are able to tolerate milk, you can take milk. You can include jaggery, you can include pomegranate, you can include raisins. Uh, uh, then you can include more spinach, beetroot, all those things which improve your blood levels faster. So even groundnut and jaggery laddus also can be prepared and can be taken. All those things will help to rejuvenate faster and get the strength back. Is there any specific or precise way or to know the Vata, Kapha and Pitta domination in us? And sometimes we may not identify the symptoms. Yes, that's why this is a question from Prayukta Danya. So stay tuned. There is a next session, upcoming session, which will be there on a Prakriti analysis, where you will get to know what is exactly Vata, Pitta, Kapha dominance, and then you will come to know whether which dosha is dominant in your body, and then as per that you can start taking the. So stay tuned. Can teenagers having pain during periods take shatavari? Yes, of course, teenagers should be given shatavari on daily basis, because that is the time period where the bleeding starts, initial phase, and when they and most of the teenagers generally they eat outside food, junk food. Now a lot of trend is going on, so there are chances that immunity will come down, and if bleeding is more, then again there are chances they might get to anemic also. So yes, shatavari can be given for them also on a regular basis. Can you provide the recording? Yeah, in the group, in your WhatsApp group, you will get the recording after this session. There is a question due to festival miss session. Okay. Is shatavari for weight loss? See, generally, shatavari is a nourishing herb, right? So it will not reduce the weight basically. It is a rejuvenation herb. So it might help to increase to some extent. Maybe if you are active, then weight gain will not be there, but it will help balance dosha. But shatavari is not for the weight loss. If you are looking for the weight loss, then opt for the triphala. There is a lot of sugar in shatavari kalpa, so there is any other way to consume shatavari? Yes, if you are taking shatavari kalpa, then it is mixed with the sugar. So what you can do, there is a shatavari powder also you get in the Ayurveda shop. Just shatavari churnam. So it is only shatavari. There is no sugar, nothing like that. But the taste is little bitter. But yes, you can take direct shatavari, which will be more effective. So yeah, shatavari churnam can be taken from a good source.
Hare Krishna, Mataji.
Hare Krishna.
What is good for immunity? Shatavari is good for immunity.
Yes, definitely shatavari help in immunity. But what kind of immunity you are asking for? Is it immunity for respiratory system, or is it immunity for overall body? Then the things change.
I feel tiredness during my menopause has started, so I feel very tired only.
Okay. So in that case, shatavari is the best choice actually. Shatavari, and even you can include ashwagandha also. So in the morning you can take shatavari, and at bedtime if you are taking milk, you can take it with ashwagandha. So both the combination of the herbs will help you more.
Okay, thank you.
Welcome. Then next question, I have a lot of a back and knee and calf muscle ache. I'm overweight by 10 kgs during periods. My aches get so bad. So yeah, I'm happy that you are able to recognize all these symptoms which are PMS. So basically, weight is more than that looks like you are more of kapha dominant female. There might chances there is a combination of other dosha also, but it looks like most of the time overweight, that means kapha dominance. So what you can do powder massage, as I have explained. Either you can use triphala powder or you can use horse gram powder. Horse gram is a kind of a grain which you will get in a grocery shop. It is also called as a kulthi in Hindi, kulit in Marathi. Okay, so you can check with them. It is a kind of a grain. Okay, you can make powder. You can also mix it with a triphala churnam. So 100 gram of horse gram powder and 100 gram of triphala. Mix it nicely. You can add some turmeric also, and then you can do self powder massage specifically on the areas where weight gain is more. For example, on abdomen, on thighs, on buttocks, you can rub nicely. And we are saying that period during the periods the eggs are bad. So make sure you drink a lot of warm water. And if you want to, because I will not, in such a condition, I will not recommend shatavari, or maybe in small doses you can take only for before period and during period, and then after that you can stop. But even you can apply warm oil on the calf where you are getting more pain specifically. And I'll recommend on daily basis, if you can take triphala powder internally also, that will help to reduce the weight. Avoid more starchy food, like for example more carbohydrate content, rice and chapatis and all, and opt for multigrain food. It should not be packaged multigrain but homemade multigrain atta. You can include jawar, you can include bajra, you can include ragi. So all these things will help to reduce the weight. And start doing some exercises when you are not getting much pain. Any special recommendation of breastfeeding mother during periods? See, basically, most of the females, when if they go for, because shatavari is very famous medicine during the breastfeeding, because it also helps to increase the milk secretions. Okay, so breastfeeding mothers during periods, again shatavari, because shatavari is generally recommended after the delivery. So if you go to any doctor, even some of the allopathy doctors also, they recommend to have a shatavari to increase the breastfeeding. So shatavari can be taken for almost 6 months after delivery, and it's not the herb just taken only after delivery, but can be taken throughout life also. So once your period starts, after that you can start taking shatavari, and can be continued till menopause. There is no harm in taking shatavari. Only moderate doses, 1 or 2 spoons per day you can take. Can we take both shatavari and triphala? Yes, you can take both shatavari and triphala. Shatavari will nourish your body and triphala will help to reduce your weight. Triphala will help to keep your digestive system good, and it will also help in hair fall and also. Yes, both of the things can be taken. Shatavari you can take in the morning along with milk or with warm water after your meals, and triphala can be taken at bedtime. So already recording they have put, so you can go through the recording. If someone has missed anything, you will get to know from the recording. If less flow of bleeding is there, then what should we do? See, basically, when less flow is there, that you have to see whether are you anemic. There are two chances: either you are anemic, or there is another chance if there is something in the uterus. So you have to rule out both the things. Check your hemoglobin levels. If hemoglobin levels are fine, then make sure whether you are in a menopause phase. If you are in a menopause phase, then slowly bleeding also comes down. If you are in that phase, then that also you have to rule out, and then do ultrasound. With the ultrasound, you will come to know whether is there anything, any abnormality in the uterus. So whatever the cause is there, as per that you have to treat. Shatavari and triphala can be taken together on a daily basis. There is no alteration. Every day you can take. There is no harm. Can take shatavari along with triphala powder. Don't mix it together, because a lot of drug mixing we don't recommend. Triphala already has 3 herbs, right? So keep separate timings. Triphala is better at bedtime, and shatavari is good at in the daytime. Can I have shatavari gulam? I'll just answer this question and we'll come to you, right? So
Yes.
can I have Shatavari Gulam and can I take this? What dosage is recommended? Yes, Shatavari Gulam is again the medicinal form of Shatavari which is available in the market, and it is in the paste form like Chavanprash, how it is that like that it is available. So yes, you can take 1 spoon of the Shatavari Gulam can be taken at bedtime or in a daytime whenever you find it comfortable. Yes, Hare Krishna.
Hare Krishna.
Yes, you can ask your question.
Hare Krishna, Mataji.
Hare Krishna.
How to reduce the? I feel during my menopause, I feel my stomach is bloating a lot. So how to reduce that bloating?
Okay, fine. See, basically, menopause period is a transition phase from Pitta phase to Vata phase, right? So when we are child, our dosha dominance is a Kapha dosha. When we are young, then that time is a Pitta dominant dosha, and when we go in a menopause phase, that is a Vata dominant dosha is coming in our life cycle. So basically, it is transition phase from a Pitta to Vata, and when Vata increases, then automatically bloating and all those issues start increasing. We can see when a female goes from a menopause phase, they start getting joint pain also, like
Yes.
degeneration phase starts, right? So
Yes.
automatically Vata dosha is coming in your life. You have to welcome it in a happy way. So it is the right time to do oil massages on the body. Start taking the food items which is sweet in taste, sour in taste, and salty in taste. So in the salt, I'll recommend you can have rock salt or Himalayan pink salt, which will help to reduce the Vata. So you can take buttermilk with by adding little more salt than a normal salt. You can take citrus things in your diet, or you can include amla, or you can include lemon also. Lemon will help to reduce the vata. And then sweet things, you can start taking milk sweets if you have missed throughout your life for the maintenance of the physics. So you can start taking milk sweets. In that, make sure don't add sugar, white sugar, but I'll recommend you can add rock sugar or the candied sugar. We call it as a mystery. So that can be powdered, can be used. So all these changes will help to reduce the bloating all those. And you can include even mint. Pudina also can be included. You can have everyday pudina chutney by adding all sour and citrus things, and that will help to reduce your vata, which has started accumulating in the abdomen.
Okay. Honey can be taken, Mataji?
Yeah, see, basically honey, it generally we give, you might have seen that generally for those who are overweight, for them we give honey because honey is has this quality, it tend to reduce the weight. So it is, and it is like it helps to slow down the metabolism. So that's why we don't recommend honey. If you are like little on overweight side, then honey is recommended. But if you are already thin person, then no need of taking honey. Mishri is a better option.
Oh,
Okay,
thank you, ma'am.
welcome. Parveen, you can ask your question.
Hare Krishna Mataji. Can you have trifla if you're on statins?
Trifla, pardon?
Yeah, yeah, I'm on statins for like high cholesterol.
Okay. Yeah. You can have trifla. There is no doubt about it. You can have trifla on daily basis. No problem.
Right. Yeah, like the previous Mataji, she said about menopause, because I think like I am going through menopause and I'm having, like you said, welcome vata, so I'm having lots of aches and pains. So I had a lot of problems with my period. So I had the coil, but then I came to a stage where there was a worry about cancer. So I had hysterectomy. So, but since hysterectomy, my health's really gone down. So I'm in a lot of pain. So I was thinking if I can take Trifla.
Yes, of course, trifla will definitely help you. You can start taking trifla on daily basis. In a powder form is a better option, but if you are not able to take in a powder form, then go for tablets. There is no harm in taking tablets also.
Thank you. Hare Krishna. Hare Krishna.
We'll go for question again in chat box. Should we eat multigrain mixed together or separately one by one? You can mix it. If it is homemade, it is better because the outside I'll not recommend the packaged food, but you can mix it and you can have separately also. No problem. There is a question, Hare Krishna Mataji, I am overweight and I have PCOD. I have heavy bleeding problem for at least 4-5 days and periods end only on 7th day. Every year, at least once or twice, I fall anemic and I have taken so many courses of medicine but no permanent solution. how to know the difference between PCOS and PCOD, what treatment can be done. See, there is no major difference between PCOS and PCOD. PCOS is a symptom which you get, and PCOD is when it becomes older, then you turn to be into the disease, right? So then when it becomes like many years, you are suffering from PCOS, polycystic ovarian syndrome. Then so all these multiple syndrome, when you are going through for multiple years, then it becomes a disease. Okay, so that is the difference. So almost same terminologies. And then you said that you get heavy bleeding, right? So and overweight, that is again sign of the PCOD. So you treat your PCOD with a proper Ayurveda practitioner. In such a cases, now not only medicine work, you need to go for certain panchakarma procedures also, and you have to take little long-term treatment, maybe 3 months or maybe 6 months also. Then only your symptoms also will come down. And you are saying that you are anemic also because of the heavy bleeding. So make sure in your food you include the food items which will improve the blood levels. As I have mentioned the list, like spinach, jaggery, dates, raisins, all those things, then beetroot, all those things. Even ragi also can be added, pomegranate can be added. So for the heavy periods now, during that time period, if you take pomegranate juice every day, your bleeding will come down and you will not become the anemic. Make sure from all these items which I have mentioned, you eat something at least once a day. So then your blood levels will remain high, and treat your PCOD with a proper Ayurveda practitioner. Take some panchakarma procedures so that weight comes down, because they are connected with each other, weight and PCOD. When weight increases, PCOD will increase. When PCOD increases, weight increases. So they are connected with each other. You have to break the cycle of this overweight with proper treatment. Once your weight comes down, your symptoms of the PCOD also will come down. There is a question I have: varicose veins in legs during PMS, and veins have shooting pain. Please suggest home remedy. See, this is a typical sign that during PMS your vata is going high. Whenever there is a pain, that means vata is going high. For the varicose vein, you need to treat for longer duration. Generally, we recommend opposite massage from downward to upward, leg massage with oil. So Dhanvantram oil can be used, or homemade sesame seed oil also can be used. Do opposite massage that you will not be able to do. You have to take help from someone else from the family. So everyday opposite massage can be done. You can even wear stockings. You can dip your feet with salt and warm water. That will also help in throbbing pain. And then certain internal medications also can be taken by the guidance of a Ayurveda practitioner. Definitely the pain will come down. There is a question: can Shatavari be taken post menopause also? Yes, Shatavari is a Rasayana herb, can be taken after menopause. Throughout female's life, she can take Shatavari. So, thank you, Rinda. Thank you, PR. There is a question: what is the best and easy way for regularizing the periods using above said churnas? What is the best and easy way for regularizing the periods? The best option is the Shatavari. I'll recommend Shatavari, which will help to regulate. And then you have to see which dosha you are. If you are Vata dosha, and if you are getting a lot of anxiety, include Brahmi in your schedule. If you are overweight or Kapha dominant person, then include Triphala along with that. So like that, you have to balance. So make sure along with Shatari, you take other herbs also. So you have to first find out what dosha you are, which dosha dominance you have in your body, and then as per that you have to choose. So I think I have answered all the questions.
Mataji, many people complain that ashwagandha increases the weight.
Yes. Ashwagandha increases weight. Yeah, if you take it for a longer period, then it increases weight. If your body tendency is to increase weight, then you can have ashwagandha only during the PMS phase. Because now you know your cycle before your periods, how many days are remaining. So almost 7-8 days before you can start taking ashwagandha and then stop it. Take it for 8 days. Once your period starts, then you can stop it. Again, next month, take it only for 8 days. So your symptoms will come down.
I'm
So,
in a menopause time. So is it recommended for me?
yes, in the menopause, generally we recommend ashwagandha because ashwagandha also helps. See, during menopause, you get psychological disturbances, your bones become weak. So, in that case, we recommend ashwagandha. But if you are on an overweight side, then make sure that either you do exercises along with when you are taking ashwagandha, you start doing heavy exercises or burn your calories. Then ashwagandha will not increase your weight. But if you are just having lethargic lifestyle, then if you take ashwagandha, it will definitely increase your weight. There is a question. Welcome. So there is a question. Can we take those churnas with jaggery? See, basically, Shatavari is recommended more. Those who are Rasa and Kalpas, they are recommended more in a water, or generally we recommend more with a milk. Milk is the best choice. But if someone is having issues with the milk, they can have it with warm water. But if someone is having difficult to have powders with the warm water also, yes, small amount of jaggery can be mixed, but better option is water and milk. So I think I have answered all the questions. If the questions are over, then we can stop. You will get the recording in the group. Already they have put in the chat box also. So I'm happy that with this knowledge, I'm helping all the females. Indirectly, I'm helping myself also. So Shatavari is one of the best herb you can include in your schedule. That will help you a lot. Feel the difference. If your symptoms still are worse, then definitely take a shelter of Ayurveda practitioner and do some panchakarma, at least 1 or 2 panchakarma sessions, which will again help to reduce the symptoms. Thank you all for all your enthusiastic questions and